Pains women should never ignore. Feeling burning, stinging, or pressure anywhere in the body is always a very unpleasant experience. Nevertheless, we often ignore these symptoms thinking that there is no real danger for our well being. The problem is that while some of these uncomfortable pains are caused by completely harmless factors, sometimes even mild aching may indicate serious health conditions. It's not uncommon that potentially life threatening diseases stay symptomless or cause mild discomfort, which is often ignored. Some people experience warning symptoms during several months before a big trouble eventually occurs. Doctors say that high number of deaths and cases of disability could be prevented if starting appropriate treatment timely. That's why it's extremely important to be aware about certain pains which may tell you that it's time to seek for medical help. Chest pain, it's probably one of the most frightening symptoms which brings high number of people to emergency rooms every day. Although chest pain is commonly associated with heart attack, it may be caused by a high number of other dangerous issues like aortic dissection, pulmonary embolism or collapsed lung. Headache. Maybe calling for emergent help because of headache sounds strangely, as anyone experiences this problem from time to time. But be aware that extremely severe headache which begins suddenly and is not similar to any previous headaches may be a sign of stroke occurrence. Low back pain. While most painful sensations in the lower back area develop as a result of muscle sprain or strain after physical exertion, sometimes they may indicate serious problems like herniated disc, kidney infection, or even cancer. Pain in the left arm. What can be really dangerous in having pain and tightness in the arm? Specialists say that in many cases heart attack causes stabbing pain and discomfort in the left arm and shoulder, which are usually accompanied by cold sweats, nausea or shortness of breath. Pelvic pain. You may feel cramps and aching in the pelvic area a few days before periods or in the middle of the menstrual cycle when ovulation occurs. But it's also possible that pelvic pain is a sign of endometriosis, ectopic pregnancy, ovarian cyst, or pelvic inflammatory disease. Leg pain. Do you have swollen, reddish and painful legs? It may be a sign of deep vein thrombosis when blood clots block vessels that normally carry blood from the legs to the heart. If these clots travel from the lower limbs to the lung, it may lead to fatal consequences. It's not about your sore throat. It's worth knowing that stiff neck is a sign of bulged disc and meningitis, while sharp pain and tightness in the neck which travels from the chest may indicate heart attack. Pain in the lower right abdomen. Stabbing pain in the lower part of your gut may be a symptom of appendicitis, which is a medical emergency. Burning and numbness in the feet. Unusual painful sensations felt in the toes and feet may develop because of diabetes related damage of the vessels. Mouth sores. Painful red or white lesions in the oral cavity may appear because of precancerous changes, folate deficiency, or yeast infection. Pain in the upper back. There is wide variety of reasons which can trigger unpleasant sensations in the upper back. The most frequent of them include arthritis, herniated disc, and traumatic injury. Earache. Pain in the ear which sometimes comes together with hair loss and fluid drainage may happen because of infection, accumulation of the earwax, or presence of the foreign body.